Welcome to TMI, a podcast by Henry Ford Allegiance Health. Well, today we have another fun show, and we have Jen in the studio here with me. Jen, how are you doing today?
I'm good. How are you, Dave?
I'm doing pretty good.
Good.
We've got a pretty cool topic to talk about today, don't we?
I'm super excited.
Can you tell us a little bit about what we're going to be talking about?
Yes. So today we've got Dr. Kate Viola from our dermatology practice here, and we're going to just kind of ask her some questions that we're kind of all wondering about and kind of let her share some of her expertise with us. So, hi, Dr. Viola. Welcome.
Thank you so much for having me, guys.
Welcome to the podcast. This is kind
Very
of a little
cool.
informal. Yeah.
I like it here.
Yeah. The show, it kind of started like the people in this marketing department here. We kind of were all on this quest to become more healthy and find out more about health things. So then we found out, we can talk to so many different doctors. It's like the best opportunity to do something like this. So
That's terrific.
we bring in the smartest people we have to talk about topics we're interested in. So thanks for coming.
Well, thank you so much for having me. It's a real pleasure.
One thing we want to talk about, though, is that this is just information. If you need specific medical advice, please consult your own doctor or physician for more information. Yeah, could you maybe give a little bit about who you are and all of the fun things you do?
Sure. I'm Dr. Kate Viola, and I am a board-certified dermatologist here at Henry Ford. We started our practice 2 years ago, so I've been here for 2 years. I did my residency and training in New York City, and I also have a master's in health sciences research from Yale. So I've done a lot of research in my past. I'm very passionate about translational dermatology, meaning the research to practice in a way that really promotes good health through research. So the medicine that we prescribe, the recommendations that we give, for me, I base on the research and the data that is out there. I think that's a really, really good and important way to practice. Awesome. It yields the best results for sure.
Great.
Yeah, I hear a lot of great things from people in the community. But what are some of the most common reasons that a patient would come and see you?
Sure. So it's interesting. I have found that it's very seasonal. So, for example, in the summertime, people are wearing less clothing, right? So they start to notice little bumps and lumps, and obviously the big contact dermatitis or poison ivy, poison oak, poison sumac, and other weird plant stuff going on.
That was me.
Was that you? Did you have that?
Yeah.
And that is really uncomfortable, for lack of a better word. So in the summertime, I do a lot of full skin exams, I've noticed, and certain skin diseases can flare. We have a lot of viral rashes that kind of poke their ugly heads as well in the summertime. So I think it's interesting, and more in the wintertime, I see a lot more dry skin, eczema. Summer, also the sun, and warmer weather can make psoriasis better. So a lot of my patients in the wintertime with psoriasis, they're coming back full steam, full of, lots of questions and concerns and flares of their psoriasis. So I think I see a lot more chronic disease in the wintertime. Summertime, a lot of skin checks, a lot of skin cancer findings.
So would I need to see a dermatologist if I don't have a skin condition that's actually bothering me right now?
That's actually a really good question, Jen. So the American Academy of Dermatology recommends a screening total body skin exam and really advocates for self-exams. This is kind of our mothership or body that we practice under, where I'm board certified through. As well as American Cancer Society, they recommend regular skin exams. And so regular skin exams for whom? I mean, that's really the question you're asking. So anyone who has an increased risk of skin cancer, if they have decreased immunity, if they have other comorbidities, cancers usually come to us as well, referred by their primary care oncologist. A history of personal or family skin cancer is really big. A lot of patients who are fair, blonde hair, blue eyes, green eyes, red heads, they burn easier in the sun, like a little bit like 2 people I'm looking at right now, I think. I see a little red in your beard there.
Yes, and I have a little tiny son. My son is so little, and he's red, and he just gets so red in the sun.
Yeah. So we'll talk about that. You better.
So when you talk about the full skin exam, so this came up personally in me and my husband's conversation not too long ago. He's been recommended to have a full body check, but he's a little nervous about that. And obviously you're a professional, it's no big deal for you, but can you just kind of explain what do you do in the skin exam?
So I think for most patients, what is daunting is that you have to take your clothes off for something, and obviously for a lot of patients, it's the first time they're meeting me. So that in itself can be daunting.
Sure.
The full skin exam entails looking at, we as dermatologists focus on obviously the skin, but on the hair and nails as well.
Okay.
So I do a full skin exam, I always say from tip to toe, starting with the scalp, the hair, we look at the eyes, in the mouth, and all of the skin on your body.
Okay.
And actually, most people will say afterwards, wow, that wasn't so bad at all. I thought it was going to be more invasive, for lack of a better word, right? But it's really not. And the good thing, too, about going to the dermatologist is that, especially at Henry Ford, you'll always see the same practitioner. So we really get to know your bodies as well as you getting to know your bodies. And we teach you things to look for and things to be concerned about and things to say, you know what, that's fine. It's okay.
Yeah.
Awesome.
That sounds like a great thing to get into. Is there like a specific age that you need to start doing this, or is it just kind of something different?
Well, as I said before, the American Cancer Society recommends 20 years and up. I like all adults to have a full body skin exam yearly, as per AAD. I do have children that I give skin exams to, and those are always where the parents have a history maybe of melanoma or many skin cancers, kids who are very fair, kids who are moly. So a lot of families where there's just a lot of moles that run in their families. And their moms and dads are concerned, or they think that something's changing on their skin, on their children's skin. So, I mean, I've examined kids who are, 1, 2 years old even.
Wow.
Sometimes children will have, or babies will even be referred to me with one lesion of concern. And what we'll do is we'll examine it and follow it closely. We'll monitor it. We'll take photos of it. It will be in their medical record, and we follow it closely over time just to make sure there are no changes, and then it's growing appropriately with the child or baby.
Great. So what's the number one thing that we can do to try to prevent skin cancer?
The number one thing you can do is sunscreen and staying out of the sun.
Gotcha.
Now, I know I have to say, and we've talked about this before, the three of us, but, sun in Michigan, obviously, with this very cold, dreary winter, people love the sun in the summertime, and you can really enjoy it, but wearing sunscreen is so critical here. So reapplying every 2 hours. I have people come to my office and they're very, very tan, and they say, oh, but Dr. V, I'm putting on my sunscreen, but they're not putting it on every 2 hours. So that's really, really important. And sun protection hats are phenomenal. Sun protective clothing, those are very, very popular now. The sun protective clothing is fantastic, and you can buy it at any price point. I've seen it at JCPenney, and then I've seen it at like REI and Patagonia and all those other more fancy, outdoorsy shops. So you can find this at any price point and in many ranges. That's the same thing goes for sunscreen. So we see sunscreen that's inexpensive, and we see sunscreen that's really pricey. For sunscreen, the bottom line is ingredients. So remember, the zinc and titanium as active ingredients are the best.
Okay.
And you can have a price point like a Neutrogena Aveeno, where it's $8, come in and we'll give you a coupon and bring it down to $6. Or you can have the fancier versions that work just as well and are fantastic too, that maybe you have a little tint in them and give you a little bit more color. But the most important thing to prevent skin cancer is protection. Protection against sun damage, which will ultimately lead to those types of cancers.
Gotcha.
And to do a full body skin exam yearly and to check yourselves regularly. many studies have shown that spouses or significant others actually are the people who are responsible for getting their their husband or wife or their boyfriend or girlfriend into the dermatologist, and ultimately, and many times maybe saving their lives.
Right?
Sure,
Yep.
absolutely.
Yeah. So, and I'm sure protecting your skin like that can help it look better over time as well. What is the number one tip you have for maybe making your skin look younger?
Well, bottom line is, and I'm going back to that sunscreen because any dermatologist will tell you, if you start wearing sunscreen early on in life, and you stay away from the tanning beds, and you can be in the sun, but you're really reapplying every 2 hours, and this is something that needs to be done 365 days a year. You can find a really nice moisturizer with an SPF of 30 that you can wear in the dead of winter here, because UVA rays go through car windows, and that's the thing. Even sun can reflect off of snow. People don't realize that, but it's so important, because also this becomes a learned behavior.
Right.
So if we learn to, put on that sunscreen every morning, and we find one that has a moisturizer that we really like, you're going to keep doing it. It's going to be a repetitive behavior. And then your children are going to see you doing that, and you're going to be doing that for your children. And then this is something that's going to just be a normal component of your life, like brushing your teeth. Yeah. That is the number one thing that you can do to to age gracefully, honestly, and prevent skin cancer. Right. Now, I will say there was a very large study a few years ago, looked at 155,000 women. And they worked with the company 23andMe that does genetic testing. Oh, yeah. And they wanted to see who were the best anti-agers, like who aged the best. And the women that aged the best, there were 4 key components to it. Number 1 was sunscreen. Wow. For an early age, they were wearing sunscreen in their 20s. They just kept reapplying. They were very good at staying out of the sun or wearing sunscreen. 2 was the genetic component. So 10% of the population had the good genes, or what they call the younger genes. So they just, their skin, their mom looked great, their dad looked great. They just had really good skin. Yeah. Sure. And, we're all jealous of those people. Right. It's amazing when you see that. And I see women who walk into my office who are 80, 90 years old, and they have skin of like a 60-year-old. And men. It's absolutely beautiful. Yeah. The other thing was moisture. So just good moisturizers, moisturizing your skin on a regular basis, eating well, drinking lots of water. Yeah. And then the 4th thing, which I found the most interesting, was patients who had a positive attitude towards themselves were 30% more likely to have younger looking skin. I mean, that's incredible. Huh. So that makes you think about like inside out kind of, thought, like that really how you feel about yourself is actually projected on the outside as well. So positive attitude, positive outlook on life, and feeling good about yourself really does truly make a difference in the study.
Goes a long way.
Yeah. I think that's really cool.
Yeah.
That is.
And I could see, that's such an interesting idea, and like this whole field of dermatology is super interesting. What are some of the things that excite you the most about dermatology and what you do?
Well, the past 10 years have been amazing for the dermatology field, and I'll tell you why. Because there has been a really huge amount of research that has come out of dermatology researchers, particularly in the field of chronic disease. So when you look at psoriasis, eczema, or atopic dermatitis, vitiligo, and even hair loss, there have been really amazing drugs that have come from these studies and are now, have gone through the FDA, and I can prescribe to my patients. So, for example, one of the best things in psoriasis is that researchers have found specific proteins actually that are part of immune pathways. So in psoriasis, you have a lot of inflammation, and the inflammation is giving you those red, terrible, and somewhat painful plaques. And so researchers have found that these specific proteins in the immune pathways, if you block them, they actually can stop this whole process. As well as in psoriasis, inflammation, studies now have shown that it's been linked to a whole bunch of other different comorbidities, meaning other problems, medical problems, inflammatory bowel disease, hypertension, heart problems.
Wow.
So
Interesting.
these medications, they're called biologics, and they're injectables. If they are injected into the skin, they can actually help inside out as well, and maybe over time help with that, heart disease or prevention of the heart disease, which is caused from inflammation.
Interesting.
So, in my opinion, anybody who's walking around with, full-blown plaque psoriasis should not be in this day and age when we have such incredible medication where they can clear body surface area 90%, 100% now. It's incredible. Wow. So that's been a huge major breakthrough. And then the other thing I think is just another wonderful thing in dermatology is there's been such public awareness campaigns on skin cancer and skin cancer prevention. You have everyone really kind of rallying around it. It's not cool to be burnt anymore, to be so tan and so dark anymore. Right. You can get that out of a bottle. You can get that out of a spray tan. Yeah. You have, celebrities. I mean, look at John McCain. Look at, from John McCain to Khloe Kardashian and like Hugh Jackman. These are people who are coming out and saying, you got to wear sunscreen.
Right.
Look what's happening to me. And a lot of people follow these celebrities now. So I think it's a really good thing that people are getting more involved. And you have companies like Neutrogena having Jennifer Gardner sponsor, doing these ad campaigns saying, I don't go out without my sunscreen. And so young people follow that. And I think that's really, really good. And
it's amazing that you can get two things in one most of the time with the sunscreen and the moisturizer.
Yes.
And it's just...
Yes,
I don't
exactly.
see why not to do it.
Exactly.
And it's just interesting to me, too, just to see the change. So, when I was in my 20s, I was in the tanning beds constantly. And that's what everybody did. And it was who can have the darkest tan. And then now... It's so different. There's so much public awareness, and you're so right. They're doing a good job because I am scared to death of a tanning bed now.
I'm glad, Jen. I'm really glad about that. I may have instilled that fear in you too. But
you did. You definitely did.
Yeah, and that's just really, really, just to reiterate with the tanning beds, there's such an increased risk of melanoma, and melanoma. One person dies every hour of a melanoma. So, and also I think in Michigan it's a cultural thing. Coming from New York, nobody was in a tanning bed. They all did the spray tans. But here, I think there's a cultural component where moms do it with their daughters. It's kind of like a bonding thing.
Right.
But, when you go there, I really tell moms and daughters, just do the spray tan.
Right.
Because you're really gonna save your skin. You're going to save your lives ultimately. And you know what? Nobody likes leathery skin, old leathery skin. And I see that a lot. I'll see a 40-year-old come in and she looks like she's 60 years old. And she always tells me, oh, I've been using the tanning bed. And, and that's hard. That's difficult.
Yeah. Cool. Well, I know we have a lot of other things we could talk about and so many different cosmetic treatments and all that stuff. But I think that's about time for today. And we can come back and talk more about specific treatments in another podcast.
Sure,
just
that
like
sounds
exactly
great.
what we can do. Where can people find out more information about you or come visit?
We do have a website, Henry Ford Allegiance Dermatology. Just Google us and you'll find us.
Nice.
And the other wonderful resource is the American Academy of Dermatology, AAD.org. They have a whole wonderful patient guidelines, great resources there. If you ever have any questions or concerns, you can always stop by our office and come and make an appointment.
And your office is amazing.
Oh, thank you.
It's beautiful.
Yeah.
Thank you. We love it. And we actually are having a new dermatologist join us in the fall, so we're super excited about that too.
Cool. Awesome.
She's lovely inside and out, and she's coming in the beginning of October.
Great.
That's how busy we've become.
Yeah, in 2 short years.
Yes.
That's crazy.
We'll have to have her on here as well.
Yes, she's lovely.
Cool.
Yep.
Awesome.
Well, thanks for joining us. If you're listening to this show and you want more episodes, you can find us online. Find us on the website, henryfordallegiance.com/podcast. And we'll have all the episodes on there as they come out. We're trying to get one every other week or so. So if you have questions, find us on Facebook. Drop us a line there and we can ask some questions in future episodes. So thanks for joining us.
Oh, thank you all so much. Have a good rest of the summer and wear your sunscreen.